April's Fool Day is all about fun and pranks. लेकिन क्या पता अगर आपका कोलेस्ट्रॉल भी आपको साइलेंटली फूल कर रहा हो। ये जो इंक्रीज लेवल ऑफ कोलेस्ट्रॉल्स है, ये बिना किसी वार्निंग के आपके हार्ट के हेल्थ को रिस्क में डाल सकते हैं. Just because you feel fine doesn't mean that everything is fine. So namaste and welcome everyone to another episode of Beyond the Pill, where health meets conversation. I am your host Dr. Chetna, and today we will be talking about cholesterol, understand what is HDL, LDL, and most importantly why low is better when it comes to lipids. To simplify this and make us understand this better, joining us today is Dr. A. Srinivas Kumar. He is the best cardiologist in Hyderabad. He specializes in TAVI and complex coronary interventions with over 2 decades of experience in this field. Doctor has performed over 15,000 angioplasties and 100 TAVIs till date. So let's give a warm welcome to Doctor today and understand more about cholesterol. Hello, Doctor, and thank you for coming to our show today, which is Beyond the Pill. And thanks a lot, Kia. You took out time for us from your such a hectic schedule.
No, it's always our endeavor to do some programs which are beneficial to patients. Not only direct treatment, but a lot of importance should be given to prevention. And that's how I take time and do such things. And I also feel it is our moral responsibility to educate masses and public. And I thank the mankind for this initiative of educating the public masses through your whatever social media, podcast, whatever you call it.
So that is what we are here to spread awareness on cholesterol today. So cholesterol has this bad reputation that all the time people think कि cholesterol है मतलब it is going to harm your body. That is how people have this opinion. So what's your take on cholesterol and what are the important bodily functions that it has?
Actually, to say it in Sanskrit, there is a saying called Ati Sarvatra Varjet. Whatever in reasonable quantities is good, but something becomes excess, it becomes poison. Same thing could be applied to cholesterol too. At birth, the cholesterol levels are very low, like 40 to 60, and then that is enough for maintenance of cell functions. But as we grow, because of metabolism of production in the body, as well as what you eat from outside, the cholesterol level go up to extent of 200 plus, 300 plus, depends. Then it becomes dangerous.
Right.
If the cholesterol, if you have to know, there's something called good cholesterol, bad cholesterol,
Yes.
people say.
Yes.
So the total cholesterol is the combination actually for both good and bad cholesterols. And the bad cholesterol is what is LDL cholesterol, which actually gets deposited in the blood vessels of the heart and various other parts of the body and leads to development of atherosclerosis, which actually, when it increases in severity of stenosis, if it becomes 90, 100%, then patients will develop heart attacks and strokes.
Understood.
Whereas HDL cholesterol is another good cholesterol, which actually removes these cholesterol particles from the blood and takes it to the liver, and that's how it gets metabolized. So, but if you wish that only HDL, the good cholesterol increases, the bad cholesterol decreases, it is slightly difficult. When you're trying to decrease the total cholesterol, both components decrease. But it is important, as you told in the intro, that cholesterol is bad,
Yes.
especially when it is increasing in the numbers, and when it crosses the normal limits, it becomes more and more dangerous. The higher the cholesterol, the more bad it is for the patient. The lower the cholesterol, it is better. The lowest is the best.
So cholesterol, like increased level of cholesterol to be specific, doesn't usually show symptoms, and the body won't show symptoms that cholesterol numbers are now rising. So how would someone come to know that my cholesterol is increasing and now I have the risk of getting cardiovascular disease?
Actually, it is only by checking the blood levels you know that cholesterol is high. Unless it becomes so severe that the plaques inside occludes the vessel totally, you won't manifest with disease.
Yes.
Right. That's why it is very important for everybody, especially for people who have family histories of heart attacks and high cholesterol levels. It is very important for them to get checked up very early, right from actually, if it is familial patterns, right from school or at least from 30 years of age, and get yourself. Just because you don't have symptoms, it doesn't mean that you have good cholesterol high.
Exactly.
It can be high. We have seen as high as 300 plus cholesterol, patients becoming totally normal, asymptomatic. But they become symptomatic, that time it becomes already late. So that is why it is better for this, such sort of education is required for public, and all of them should just get cholesterol checked. And depending upon what is the level of the cholesterol in that person, we advise them how frequently it has to be repeated. So that's how it is important for everybody to at least get their cholesterol level checked after the age of 30 years if there is no family history. But if there is a family history, the more early too. Other
Yes.
thing what we see in India is we see very young heart attacks.
Yes.
Normally in
That has
West
become
we get
very
about
prevalent.
50,
Yeah.
60, but in India we do see heart attacks at 30, 40. Suppose somebody in the family has got, then prior to that, a decade prior to that, probably you could get yourself cholesterol checked so that you won't go into it. So the
Understood.
earlier
Understood.
you get it evaluated and get it managed and treated, you can prevent the occurrence of heart attacks. That is the most important thing what we would like to convey. So
Yes.
don't think that just because you don't have symptoms, you don't have high cholesterol. That's how you could say it as silent killer, whatever you call it. But it's always important to know that it is very prevention is better than cure. So taking your cholesterol checked, and if at all if it is high, taking treatment is very important. That's what we call it as a primary prevention. Before somebody develops heart attacks or paralysis, you should check yourself and get treatment. So unfortunately, somebody already suffered a heart
Yes.
attack or stroke, then you still give treatment. That is called a secondary prevention.
Okay.
In
Okay.
such individuals, we need to control cholesterols more aggressively. More low levels are better in such individuals. So that is why it is important in which milieu the cholesterol is high. If the patient already suffered disease, then you have to be more aggressive in treatment.
Understood. That is like a very important message that needs to really pass on to the population now. And also, I would like to understand that which is the population which is more prone to getting this increased level of cholesterol, like men, women, or someone who's obese, or someone who has other comorbidities.
Yeah, if they have other comorbidities, more likely to be abnormal. But what I would like to mention is this is sometimes also seen in very thin and very beautiful looking females like you also could have high cholesterol, because in the sense that it doesn't go by always by weight or always by your what activity, yes, to some extent,
Yes.
and then maybe food intake yes, to some extent, but it's all only about 30% of the cholesterol is contributed to all this. 70% is inborn in the metabolism, it derives from the body. So
Understood.
that's why some scenarios where you call it hereditary hyperlipidemias, their cholesterol levels could be very high. So if in other words to say, a patient who has high lipids, if he does not do exercise, eats all bad junk, it further increases.
Yes.
So, but however strict you are, in some individuals, it could be still high. So, 70% is something like forms within the body, and 30% is what is extraneous things contribute. So, what we advocate is all of you should maintain healthy lifestyle, decrease your weight, do walking, yoga, meditation, all that, along with avoiding eating junk foods. I think along with it, if still cholesterol levels are high, many of them need treatment. We have very good medication called statins to control
Yes.
these
Yes.
cholesterols, which are very safe. Unfortunately, many of them think that they're not. They have a lot of side effects, which is not true. And we have nowadays got a very new injection, which many of the Indian companies like Mankind and others have also brought, which is actually once a shot, insulin-like shot injection, and you can decrease your cholesterol levels to single digits LDL cholesterol. That's very
Understood.
good for patients and very safe injection.
So I think that most of it has been really covered by you, from be it non-medical treatment and also the medical part of it. But also I want you to help us spread this awareness that how important is it to have this conversation within the family and to encourage our family members to go for screening or to maintain a good diet and healthy lifestyle.
Yeah, that is actually universal. You have to remain healthy means you have to take time for yourself. Many of them say that I'm busy, I can't do exercise and all that. Then you should be ready to get into trouble.
Yes.
But the hospitals are not here only to treat when they become sick. We also want to spread message. Apollo has this pro health concept where we want the people to come to hospitals when you are healthy and get your risk factor checked, be it be cholesterol, be it be blood pressure, diabetes, and then if you have family history, especially, you should be more aggressive and come for preventive checkups very early. Unfortunately, if you have any of these, we have very good treatments to it. That's how you can control your risk. If there's one study seriously is conducted and systematically analyzed in our 25,000 plus population, saying that in one group of patients, if all these what we recommend is followed, other group is negligent, does not follow, then the difference in the heart attacks, paralysis is not 1%, 2%, 10%. 80% you can reduce the risk of getting into trouble. But if you follow these measures, what we call as lifestyle modification measures, and if you have risk factors, taking treatment. But
Understood.
unfortunately, people think that they're resistant, they don't want to get treatment, and they suffer into problem. So
Understood.
scientifically, it is proven data. But if you can take time for half an hour for yourself, do walking, morning walking, cycling, jogging, swimming, yoga, whatever form of exercise, and eat healthy, and then don't stress yourself, don't get into habits of smoking and other things. And if at all you develop risk factors like hypertension, diabetes and lipids, you take treatment and you can remain healthy by up to 80%. So whether you want to remain healthy by 80% or not is your choice,
That is
for
true.
which you should spend some time and effort. If you're some other person does it, you can't become healthy. So it is your effort, it is
Exactly.
to be done.
That is true. So, sir, knowing that जो HDL है, I mean, we really don't have control on it whether to increase it or decrease it, but then we do have control on LDL. Like we can control it through diet. I mean, diet also plays a big role, and people have this block that cholesterol is directly related to what you eat. So, do you have any recommendations that people should eat, and also if something that people should avoid?
Yeah, it is. As I said, 30% of the cholesterol stuff can actually be decreased by eating healthy. And as you said, LDL cholesterol is more bad. HDL cholesterol, people say alcohol intake is little better to increase. Doing long walking is better. That is all very minimally happens. But in India, none of the studies showed that alcohol intake will increase the good cholesterols. Only wine in small quantities, slowly taking in Mediterranean climates, it has shown some benefit. But overall, it does no good
Okay.
because it increases triglycerides and leads to again more problems in the heart. Coming to healthy diet, any vegetarian diet is good. Anything you want to eat in moderation is better. And then probably eating, if you want somebody who wants to eat non-vegetarian, probably fish has some antioxidants and cholesterol lowering stuff you can take. And then avoid eating too much of red meat and fatty foods. And then sweets and too much of excessive carbohydrates are also not good. So you'll ask me what a patient or person has to eat. You're not allowing fats, you're not allowing sweets.
Yes, yes.
So only
What will you
proteins,
eat?
only proteins are left. But our nephrology colleague, kidney specialist, will say that that also you can't eat
Yeah.
because it damages. So what I want to say is anything in moderation, in
Understood.
appropriate quantities is good.
Understood.
Keep your portions limited, and then probably do some amount of exercise
Understood.
and eat healthy. And another important message which I would like to keep before closure is basically don't stress yourself too much. I would say Pancha Sutra for heart well-being. So what is all it is? Adequate sleep is required, maybe 6 to 8 hours a day. That repairs all the damages done in the body. Then eat healthy, do some sort of exercise, and then don't stress yourself too much. Be happy. Wherever happiness, as long as you're not causing trouble to others and not indulging in these bad hobby habits, happiness prevents disease. And don't stress yourself too much. And lastly, if you have risk factors like diabetes, blood pressure, high cholesterols, take treatment. As I mentioned, now not only statins, now we have very good injection which can be
Yes.
taken just once in 6 months, which aggressively controls your cholesterol and remain disease free. And you have a choice to make, and whether you want to remain healthy or you want to become sick. So, but please know that you have very good medication to control the high cholesterols. If you are averse to taking daily tablets, now you have injection which can be given once in 6 months, totally safe. But of course, it will be expensive initially. But as the research goes on, more such molecules come, then the cost also would come down. But for people at least who can afford and then want to, if you have high family history of cholesterols and some events already, then you can protect yourself by taking this once in 6 months injection.
Thank you so much. I'll not take much of your time now, just like a very small segment that is like a rapid fire segment. So I'll start with the questions,
Yes.
okay? One major misconception about cholesterol that needs to go.
Thinking that cholesterol is bad is understood, but people think that tablets to treat cholesterol have a lot of side effects. That is wrong.
Right.
So they're quite safe.
Then LDL versus HDL, if you could give one word description, what it would be?
LDL is bad cholesterol, HDL is good cholesterol.
The most underrated habit for a heart healthy life.
Underrated, I wouldn't say it, but underutilized. People think that even if they sit ideal and watch OTTs, nothing happens. It is not true. You have to keep yourself active and
Understood.
practice some sort of exercise, if not walking, jogging, swimming, cycling, some activity. If elderly people who can't do any such activity, at least yoga and meditation is also found to be effective. So please make yourself comfortable with one of it and remain happy.
At what age should someone start getting their lipid profile checked?
If you have family history like high cholesterols, like what we call as family hyperlipidemia, the earlier the better, maybe from schooling. But if you don't have anything like that, at least from 30 years plus.
Sure. One food people think is bad for cholesterol, but actually it isn't.
Eating like badams and nuts, people think that may be
Eggs.
bad. And eggs, maybe again, some people think it is good, bad. Again, they're not that bad. But anything again in excess becomes bad.
What is more worse, high LDL or low HDL?
Actually, if you have to counterbalance, high LDL is more bad, but low HDL is also equally bad. But if you have to have a balance of select one of it, probably high LDL is more bad.
Okay. One red flag in routine checkups that people tend to ignore.
Like that blood pressure checked, it will be 150 by 100. They think that it is age related mild abnormality is okay. Somebody says sugars are 120, it is okay. That's not okay. So already people who are normal for some people already becomes abnormal for people who already have some disease. So
Right.
don't yourself decide whether it is normal, abnormal. Please go to a consultant, qualified doctor. Again, take his opinion before you decide what is good, what is bad.
Second last question, statins or lifestyle changes, which comes first?
Lifestyle changes is like maintaining your health always. Like that is anyway there. The part of statin treatment also lifestyle changes are there. Treatment with drugs is not replacement for the lifestyle changes. Lifestyle changes ought to be done anyway with statin. But beyond a point, lifestyle changes fail to control your cholesterol. Then the statins come to your play. With statins also, if it is failing, then you have tablets like SD-MIB. Now you have this newer injection called inclisiran, which is a boon to prevent. And if you start taking that right from an early age, if it is recommended, you can prevent the occurrence of heart attack totally. And our Eugene Braunwald, the father of cardiology, said how to remain without heart attack till 100 years of age. This injection could help you a lot, and this could be considered as a vaccine for coronary artery disease.
Beautiful, sir. One last one, the biggest mistake people make when trying to lower their cholesterol.
People think that once they start taking tablet, they need not do exercise, need not do follow lifestyle modification, they keep on eating junk. Then that's not true. So even if you take tablets, lifestyle modification has to be part of it. And then if you think that just because you're taking tablets, you want to eat everything, do everything, that doesn't serve the purpose.
Understood.
Then actually, in fact, people think that tablets are not working. It's not so. So it is important to follow lifestyle modification along with tablet.
Thank you so much for joining us and giving your time. I know you have literally come out of a very hectic schedule. Thanks a lot.
No, thank you. Thank you again, Mankind, for this interviews and spreading this message. And it is very, very important to think that cholesterol abnormalities in general, I would say, not only high cholesterol. In India, we do have some patients with low cholesterols, but still they suffer heart attacks. That's what we call it as dyslipidemia. The type of cholesterols vary. LDL cholesterol may not be very high, but HDL cholesterol is low. Triglycerides are little high. Anything in borderline. Again, in such minimal abnormalities in patients who already have other risk factors like diabetes, hypertension, it becomes more abnormal. So all of you get yourself checked, and then nowadays you should be aware that there are good methods to control all these risk factors, and there's a chance God or nature has given you to remain healthy compared to those people who become sick by 80% reduction of your risk. So whether you want to go the healthy way or become sick and come to hospitals is your choice. So again, thank all of you for patient hearing and seeing this program, and thank Mankind for the opportunity.
Thank you for your valuable advice, sir.
Thank you.
तो आज के एपिसोड से हमने ये समझा कि रेगुलर स्क्रीनिंग, लाइफस्टाइल चेंजेस एंड विद राइट चॉइस ऑफ ट्रीटमेंट इट कैन मेक ऑल द डिफरेंस. सो लेट्स जस्ट नॉट सेलिब्रेट अप्रैल फूल्स डे विद प्रैंक, but let's make a reminder to be wise about our health, because when it comes to heart health, low is better. If you find our videos informative, don't forget to subscribe to our channel and follow us on Instagram at Mankind Specialities for more valuable health discussions. Until then, stay informed, stay healthy.